I want to turn to this concept of masks and skin conditions. Okay. So folks are wearing masks as they should, and people are developing some rashes around their masks. There's a term called maskne. I don't know if you've heard that. Acne,
Oh, I've heard,
acne from
I've
a
heard
mask.
Maskne and I've heard butt knee. Anywhere that we can have breakouts, you can have a knee, and in this case, you're talking about facial eruptions as a result of
Yeah.
wearing the mask.
So how do we help consumers sort that out? So it could be acne, but it could also be rosacea, right? It could be contact dermatitis. So when you're looking at a patient that comes in with, some eruption around where their mask would have been, what's your advice to them?
Well, like you said, what did we learn in medical school? Diagnosis, diagnosis, diagnosis. And you went through sort of a brief differential diagnosis. You're wearing the mask, you're getting a skin irritation. Most important thing is figuring out why. So is it an allergic reaction to the mask itself, the material in the mask? Is it an abrasion, a breakdown of the skin as a result of wearing a mask that isn't soft? And in most cases, we're talking about maskne. It's just a form of acne, which is what? It's a blocking of the pores, the sebaceous glands in our skin. Wearing this mask, it's the perfect environment. It's moist. The mask may be dirty. You may have makeup on. You may have some dirt on your face. And what are you doing? Well, you're occluding that. You're rubbing it into your face. So you're just setting yourself up for a classic clogged pore situation that translates as an acne-like process. But you alluded to it. If you have underlying skin conditions, such as rosacea is one that you mentioned, other dermatitis things, wearing the mask may aggravate that. So you have to be, you're a little bit of a doctor yourself, be a sleuth, do the differential diagnosis, try different things, but it's very important. I always say a good facial routine is important for everybody, but we're wearing masks now, so we have to be particularly careful. And we're wearing masks for extended periods. If you're in an enclosed place, you're flying, you're wearing a mask at the gym when you're working out. These are all setups for maskne. So in those situations, you want to remove your mask briefly, maybe every 4 to 5 hours. Make sure your mask is clean, and you have to get yourself involved in a good skincare regimen with great cleansing, exfoliation, and then moisturizing.
Well, let's talk a couple more tips for folks. Does the type of fabric matter? Many people wearing cloth masks, some people wearing surgical masks. Do you think that makes a difference for most people? You mentioned contact dermatitis, or I mentioned it too. That's going to probably occur pretty early on, right?
You would put on a new mask, for example, that you haven't worn before, and you see an irritation. So that's the red flag that it's the mask itself or something in the mask itself. For example, if you wash your mask, it may be a new detergent you're using or fabric softener. That can also give you a contact dermatitis.
What about makeup? You mentioned makeup. Is that making matters worse? Should you not wear makeup underneath?
Well, I'm not telling, people need to wear their makeup. People aren't going to stop wearing makeup probably, but obviously I would recommend a, non-comedogenic, meaning doesn't form blackheads makeup, something that is non-allergic, and use that type of makeup, and make sure that you don't leave it on too long. And as I said, make sure you're washing thoroughly in the evening once that mask is off.
So let's go over again Dr. Andrew Ordon's top tips for good skincare for the face?
All right, so important, young, old, male, female, you got to take care of your skin, largest organ of the body, and our natural barrier from that world outside there. So, number one, it comes down to cleansing, using a cleanser that's mildly abrasive, opening up those pores, stimulating circulation. Exfoliation, what that means is removing that dead layer of skin so the new skin can form down from the deeper layers of the skin. Moisturizing, so everybody's skin is a little bit different. Some skin is oilier than others, but the point is you don't want your skin too dry or too oily. So you've got to experiment a little bit with the soaps you're using on your face and the moisturizer. If you have naturally oily or moist skin, then moisturizer isn't as important for you, and you can use less of it. And then finally, so important is protection. I can't emphasize enough the use of sunscreens, sunblocks, wearing hats, wearing sunglasses, avoiding sunlight at the hottest, brightest time of the day. So those are all tips.
How often should you change your mask? Should you wear a different one every day? Should you have a batch of disposable ones?
I think you should. Well, I personally like the feel of cloth masks better. So I wash mine regularly. That's my routine. But sometimes
you have more than one, I bet.
Yes, I use my Plastic Surgery Institute mask. I don't have it to pull up, but yes, I do have a number of masks, and I make sure that I keep them clean. And during the course of the day, I try to make sure that I'm keeping my face clean. When I wash my hands, I try to give my face a little wash too. And knock on wood, so far I really haven't had any irritations from wearing the mask. And that's a great point, John. We don't want people to stop wearing their masks. If you're getting some irritation, look into why that's happening, make the necessary changes, because we're not quite out of the woods yet.
When should you go see the doctor? Should you put on some either retinol or benzoyl peroxide for a couple of days, or maybe hydrocortisone, although they were treating different things? When do you say I should check it out? What's your advice? Because everyone can't run to the dermatologist or their primary care doctor right away.
I would first swap out the masks and determine if it's something in the mask itself, and gently cleanse the face, give it a little bit of time. And if that doesn't work, then you can try some of the tried and true acne preparation. Salicylic acid, benzoyl peroxide is also good. And it's difficult. Skin differential diagnosis can be tough. If it looks more like an irritation and not acne, then using a 1% hydrocortisone you can get over the counter is worth a try too. You're not going to hurt anything with that.
In small amounts for limited.
Small amounts, yes.
Yeah. All right. Well, Dr. Andrew Ordon, host of The Doctors, it is great to see you again. Thank you for all that you're doing to inform the public, to keep them safe, as well as point out to help them look good too, because that's important as well for our psyche. So thank you.
It sure is, John. And you keep up the good work too. I'm a big fan of yours.